Hi all, this is Dr. Priyanka Mehta, obstetrician, gynecologist and laparoscopic surgeon. So in the previous video, we discussed about papsmear, how it is important to do a papsmear regularly once you are sexually active, once you're married. Because many women do not do the papsmear regularly because many of us are not even aware that something like this exists. So once you've done your pap smear, which is done very simply, it is not painful, it is just sometimes uncomfortable. So you should not have the fear of pap smear, you should get it done regularly. But the pap smear report sometimes can come as a abnormal report. So if the report is normal, we just do it again after 2 years or 3 years. Usually when you do 3 or 4 normal smears, then it is good that your risk of cancer really reduces to very, very low. But if the report at some point of time comes as abnormal, do not worry. Sometimes if you have an infection in the vagina or an infection in the uterus, that also can be picked up by this pap smear. So your gynecologist will treat you for that infection. If, however, the report says that there is a low-grade lesion or a high-grade lesion, which means that there could be a underlying pre-cancer condition which needs to be treated, then your gynecologist will advise you something called a colposcopy. So colposcopy basically means that it is again an outpatient procedure. You don't need anesthesia for that, and you will be made to lie down on the couch, and it will be ideal if you do not have your period, and using a magnifying telescope, which is called a colposcope, which is going to be placed outside, we are able to look at your cervix, the lower part of the uterus, in a very, very clear manner. And if there is a problem, then we can either take a biopsy, we take a small tissue from there, we take a little bit of material which looks abnormal, and that is again analyzed very detailed manner in the pathology lab, and then we get the report. The report could be just normal, again some kind of infection, or if there is an underlying pre-cancer lesion. It all depends on what stage it is. So if sometimes it is a problem which you cannot see with the eye, it is microscopic, but it is somewhere under the skin of the cervix, the lower part is having some problem. We don't always need to do a total removal of the uterus, but sometimes just the lower part is removed, which is called, either it is done by cautery, which is called a Let's procedure, or sometimes just the lower part of the uterus is removed. So it all depends on what is the finding of the pap smear, what is the finding when we do the colposcopy, or a detailed magnified look of the cervix, that is called colposcopy. And once we do the biopsy, what is the report, what is your age, do you have children, how many children you want, what is the further plan is made depending on all of those things. But again, the underlying key point is that you go for a regular checkup, because cancer of the cervix is totally a preventable disease. It's the only cancer which is preventable. In fact, we have an HPV vaccine, a vaccine which is available against the virus, and that can be taken as early as 12 years, so that with regular screening and pap smear and with the vaccine, we can almost totally eradicate or remove the cervical cancer. To take care.